Hello, listeners, and welcome back to the Digestible Podcast, where we give you all the health and wellness information you need in an amount of time that your busy day can handle. And we make it easily digestible. I'm Stacy, one of your co-hosts, along with my sister Melissa / Missy. Missy, today we have someone really special. Her name is Dr. Gayle Bereskin, and I met her and Kathy, the death doula who we had on a couple episodes ago, together at a meeting I was attending. They both spoke, and I was so moved by what they do and how they can make life-limiting illnesses and the dying process so much easier for people and those around them. You want to tell us a little bit about Gayle?
Sure. With nearly 30 years of experience as a board-certified family physician, specializing in hospice and palliative medicine, Dr. Gayle Bereskin, DO, offers a holistic approach to chronic and serious illness and life transitions for patients and their loved ones in the Chicago metro area. Her patient-centered care recognizes the interconnectedness of mind, body, and spirit, addressing the unique needs of individuals and their caregivers. Understanding the emotional and psychological burdens that often accompany these journeys, Dr. Bereskin provides ketamine-assisted therapy as a powerful tool for fostering deeper acceptance, inner peace, and enhanced well-being for everyone involved. And I have to say, one of the things that I felt our listeners will really appreciate is how she described how we create neural pathways when we have an experience in our life and how that can basically determine how we manage emotions and other experiences and how you can sort of rewire your neural pathways during these ketamine-assisted journeys. And I just thought, wow, I mean, what an exciting opportunity for people who are dealing with big, heavy things in their lives that they need to work through.
I agree. I feel like she really taught us a lot, especially for those of us who really don't know that much about ketamine. So she kind of really explains what it can do, how it came to be, and it was really a lot of good learning, I thought.
For sure. Enjoy.
Enjoy. Hi, Gayle. Welcome to the podcast.
Hi, Stacy. Hi, Melissa. Thank you so much for having me today. Really looking forward to our conversation together.
Absolutely. We are too. Let's start off with, I think, an important question, which is what is ketamine and what are the different ways that it's used medically and therapeutically?
Great question. So, ketamine is a pharmaceutical. It was discovered and field tested in the 60s and 70s. It was developed as a field anesthetic, meaning that it's not a general anesthetic like when you need to be intubated for major surgery. It's a dissociative anesthetic, which means that, for example, if you came into the emergency room, broke your arm, and the orthopedic surgeon would need to set it, you would want some anesthesia on board, right? Not just pain medicine, but some anesthesia. And so that's used as one of our dissociative anesthetic medicines. And it was really developed and used in the field in the Vietnam War, right? So triaging soldiers and getting them some anesthesia in the field, right, before they could get medevaced. My first experience with using ketamine as a physician was about 15 years ago now, using it as an adjuvant or an adjuvant pain medicine or a pain medicine in tandem with our typical opioid medicines in hospice. Because it does have, it provides a lot of pain relief. So that the doses of ketamine used for pain are way less than the anesthetic doses. Okay. So if we shift now, so we've talked a little bit about developed as an anesthesia, lots of use as a pain medicine. But if we switch over into sort of the mental health piece, which I think is what we're talking mostly about today, again, in doses way lower than anesthetic doses. Ketamine was found, and again, a lot of the studies starting in the 70s and 80s was found as a treatment for depression, and really useful in treatment-resistant depression. So folks that have tried a lot of different medications and just not been getting any relief. And then use, again, a lot in the emergency room for people coming in acutely suicidal. It can help break that acute suicidality and provide relief. People obviously are, I'm going to put it in air quotes, cured. They're still needing therapy and interventions, but in terms of that acute suicidality, it's able to help break that.
Okay.
Not all cases, but in a lot of cases.
When you said dissociative early on, did you mean like, is it the same thing as if you go into like a twilight where you're not really asleep, but you won't remember it kind of situation?
Yeah. So, more than that, I think when you're talking about twilight, you're probably talking about a medicine called Versed, which is often used when we have our colonoscopy.
Right. Yes. That's what I thought about. So when you said
Yeah. So
dissociative, I'm like, that's right.
So it's a little bit different than that, but great. Yeah, great question. So dissociative meaning you're out of your body.
Okay.
You're literally feeling out of your body, so that whatever that pain or whatever that procedure is sort of being instituted, you're out of your body. So again, that orthopedic surgeon could come in and reset that arm for you.
So how does it work in the brain exactly?
What happens is there's a part of the brain called the default mode network. That's kind of what's writing. It's like kind of always in the background. And it's in that default mode network that oftentimes I call it the gremlin voice, that gremlin, that rumination of, I'm not worthy, I'm not good enough, sort of that wringing of the hands of the anxiety, all of that perseveration behavior and thinking happens in that default mode network. And so literally what ketamine does is, as well as the other psychedelic medicines, psilocybin, LSD, it turns off that default mode network. So it gives you relief, right? And then it helps you kind of take that off ramp and allows you to write a new narrative, right? So, and in tandem with a facilitator and some therapeutic intervention, right? So you're turning off that gremlin loop, you're finding that off ramp. And that's called neuroplasticity, right? So literally making new pathways in your brain to look at something, right? It also shows that it helps increase the little dendrites in our brains. That's you probably have seen a nerve fiber, and then kind of like I'm looking at the trees as they're starting to bud, like all that new growth.
Wow. Yeah.
So it does a lot in the brain. So even without necessarily, some folks may not have a deep experience, you're still setting off this cascade of neurotransmitters and turning off the default mode network.
So, like, for example, if somebody had early trauma when they were young and they were still developing their neural pathways that made them sort of triggered them into some sort of anxious mode or defensive mode or something when they see or hear something, it sort of helps reprogram things like that. And can it do that with just one session?
Well, so you've asked two questions.
Yeah, I'm sorry. Yes, I did.
So, and I hope I can say it as elegantly as this neuroscientist. Her name is Gayle Bereskin. She's a neuroscientist and has worked a lot with psychedelics, and I've learned this from her. She proposed this concept, but that what everyone's looking at now is, are the psychedelics going to that critical period, right? Opening back that critical period and opening that window to sort of redo the event, right?
Wow.
So if you
Yeah.
had trauma at the age of 12, are we going to go back there, open that window, and then start we've already talked about the neuroplasticity, right?
Mm-hmm.
And then neurogenesis and to rework that trauma or that incident, right, in that critical window, to go back to heal, to ultimately heal, right? And that's what I mean by kind of taking you out and writing that new narrative. And when I'm saying taking you out, and this is going to get a little esoteric, but ketamine, because of the dissociativeness of the anesthesia, can feel like an out of body experience. It also can also feel, and there's been research on this too, feel like a near death experience. And so it affords you a window, literally a window to look at things, almost like a life review, even if you're not at the end of your life. If you're just talking about you just got divorced, fired, and moving, right? The trifecta of stress, and somebody's trying to come through that. Can it help you open that window to write that new narrative of it instead of the negative piece? Well, perhaps it can spur somebody to think, okay, I'm now hitting a reset button. What can I do for myself moving forward?
Like a mastery rather than
Correct.
being at the
Correct.
will of your reaction, your feelings, sort of like an
Correct.
opportunity to master
Right.
the issue. Okay.
Right.
Wow.
So can it help you with a little bit of the emotional intelligence, right? So if we're talking about these critical windows, if you didn't have an ability to develop your emotional intelligence back, right? What's that window, 10 to 13 or whatnot?
Mm-hmm.
Then, you're carrying around a reactivity all your life.
Right.
You're reacting to things.
Right.
So can this help you get back there to rewrite that story, rewrite that narrative?
It's interesting. I read a book decades ago called After Silence. It's about a woman who had been assaulted in her home, and she was learning about and trying to understand why she was reacting and behaving the way she was and trying to heal from it. And she said one of the things she learned is that people who are victims of a crime or, victims of some trauma or violence will sometimes try to put themselves back in a similar situation and then to create a different outcome for themselves. And they call that mastery. And it sounds like this is like a much better way to go about kind of re-entering, opening that window and going back and changing.
Right. Yeah.
Like fixing.
And I think that's a great analogy, what you just shared. Except instead of going back into that trauma, right?
Or a dangerous situation, right?
A dangerous situation, whether physically or more emotional trauma, right?
Mm-hmm.
You are in a container that has been curated for you, right? With a facilitator. And I use the word facilitator because I'm not a therapist, I'm a physician. So I don't want to call myself a therapist, but often my therapy colleagues are sitting with, patients. You're getting the support, right? So there's the prep, there's the container that's being created for you, and then most importantly, it's the meaning making or integration, right? How do we make meaning out of what you just experienced?
Tell us about what you do in your practice and how you're helping people.
Yeah. So for over 30 years now, I've been a hospice and palliative medicine physician. And how I'm bringing ketamine to that population. Well, and I'm honored and humbled that I can provide this work for this cohort of folks. So when folks are dealing with a chronic and serious illness, and whether it's at the beginning or they're in a transition period to maybe hospice, the last maybe 6-12 months of their life, some folks do the journey beautifully. Some folks have a lot of trauma just being a patient in our medical system. I think it's fair to say everybody experiences some medical trauma. And then I think along with that, some folks may have a lot of death anxiety and demoralization, loss of personhood, right? How do they identify? If, for example, if It's a 65-year-old gentleman with lung cancer. And he was a powerful executive, and that's how he identified. And he's no longer doing that work. And maybe has had some suffering along the lines of the chemotherapy, right? And now there's that loss of personhood of how he's identified. You can see how there'd be a lot of demoralization for that
For
gentleman.
sure.
And so the ketamine can help people again, as we sort of talked about, and I think what you used the term mastery, Melissa,
Hmm.
right? How do we get folks to live until they don't, right? To really live the best life until life is no longer sustainable because of their chronic illness, right? So, how do we get them to live instead of waiting to die? Because what I have seen in my 30 years of this is some people, they do live and they're doing bucket lists and they're holding court and people are coming and they're having parties and, they're doing visitation. And some people are just literally waiting to die. And that's certainly not what I would want for myself or for my family, right? And I think all, nobody really wants to just sit and wait to die. So how can we shine the light on this is an opportunity now to just live, right? To live your best life. And again, talking about the same default mode network and giving people an opportunity to see, sort of literally rise out of themselves, look down from a third person objective viewpoint to write a new narrative. So they could say, this cancer sucks. Or like they do on shrinking, F. Parkinson's, right? You
Right.
know, say it. It's true. It does sting. But then to say, okay, but now what's it going to afford me? Am I seeing nature more clear? Am I getting real with my relationships and communication? What am I making peace with my God? I don't know. It's different for each person, right? And so how how can we change the narrative? And so that's how I'm using ketamine in the hopes that it helps my patients.
That sounds great. So, what does a session typically look like? I came in, or do you visit your patients and
Mhm.
steps one, two,
Yeah, and
three?
so sometimes I go to people's homes and I pay a lot of extra medical liability insurance in order to be able to provide that. And
Great.
sometimes people come into the office because that's maybe a safer space for them. Both work.
Sure.
Um, so I'll just kind of give you the whole process instead of just the journey day. So the first thing is for me to get to know them a little bit medically. What's your medical conditions? What medicines are you on? And make sure that it's safe for folks to participate, right, in the medicine, in the ketamine. And there's really very few reasons to keep anybody from a ketamine session. Certainly if somebody has uncontrolled hypertension, not if you have hypertension, if it's uncontrolled, that would be something you would need to control before entering a ketamine session. Some cardiac issues, but for most folks, um, there's really no absolute no-nos to use ketamine. A couple of medications we wouldn't want you on, but you can work around just holding them for a day or two. So you need to have a medical consultation, a medical evaluation, and then preparation. So however many visits that takes to prepare somebody. Maybe people are used to being in a non-ordinary state of consciousness. Maybe they've been having a meditation practice for years, so they're comfortable in that space. Excuse me. Maybe they've had a history of using other psychedelics, so they're comfortable in that space. So, and maybe somebody's never had those experiences. So want to prepare people for what it's like, right? To go into that non-ordinary state of consciousness, to maybe feel like you're not in your body anymore. to maybe do some breath work with people. So if they're feeling a little anxious once the medicine goes in, how can they help mitigate some of that anxiety just with some breath work? So there's some preparation around just how to prepare for the journey, but more so the preparation of what are the issues you're facing? What are those things that are affecting your personhood? What is the death anxiety about? What is the demoralization about? Um, I'll just pivot for a second. I've been seeing a woman who is undergoing treatment for breast cancer. And she's 65. She had some trauma back at 18, um, in her hometown, which was small. She was part of her local church community. And she had her priest was a sexual predator. And she had, he, violated her. And and she's compartmentalized that she was a high functioning lady in her career. She compartmentalized all this and actually just never really thought about it. And then it has come back in full force because of the cancer and going through the cancer and everything that brings up. So that's what she's bringing to the ketamine sessions of hoping to get some resolution around and some of the guilt and the shame. So there's the preparation, so preparing people what it's like to be in a non-ordinary state of consciousness, but then preparation of what are you bringing to the sessions? What are you hoping for? What are your expectations? What are your intentions, right? So that's the preparation phase. And again, that could be one visit, it can be 10 visits, however long it takes until people are ready. Everyone always has a little bit of has some trepidation, and healthy trepidation is good to come in because that means you have some reverence and respect for what you're about to undertake, right? And then, do you want me to keep going and talk about the session?
Yeah.
How I do it, because we're entering a non-ordinary state of consciousness, I think that's a sacred moment. And so I like to do a little bit of ritual around that. It's not that people just come in, I check their blood pressure and I give them a jab. We'll spend some time talking. If they come into my office, I have an altar of just things that are important to me to help me ground the space. But I encourage people to bring something that's important to them. Maybe it's a photo, maybe it's a trinket from a vacation that they took with their beloved, whatever it is for them, right? To put on the altar. And then I encourage people to bring either a piece of poetry, a psalm, a reading, so we can bring that into the space as well. And we do all that after I just do another quick set of vitals. Check in again with intentions. And then people are provided an eye mask so that keeps people's eyes closed and kind of has that inner directed experience. They're in a reclining position. I have a really nice recliner chair, almost akin to like a chemo chair in my office. If we're at their home, wherever's most comfortable, I don't want them totally lying flat, but in a reclining position. Make sure that ask them to tidy their space if it's not tidied before I get there. If I'm going to someone's home, I bring an altar in a bag, some flowers, a little candle, I bring it with me, and make sure they have a cozy blanket. Sometimes temperatures fluctuate, but we want people cozy and comfortable. And then the ketamine journey is sonically guided. So one of the analogies I use is the ketamine is a trip down the river. The music's your raft. Okay, so there is music that helps keep you, kind of guides you, but also keeps you, I don't want to say grounded, but help you remember that you're still in a body, you're still a vessel. There's this
Well, like
medical wait.
tethered to yourself.
Right. You're going to come back and I'm there to watch over you. Um, so, and then I give people a jab. Sometimes if they feel like they feel the medicine working, but they don't feel deep enough, maybe 12, 15 minutes, I'll give them a smaller booster dose just to get them to go a little bit deeper. Everybody's variable with how long they last in the medicine space. I've had people last 35 minutes, I've had people last 90. It's so variable and it's not dependent on the dose. And if a person has multiple sessions, it can vary between each session.
But
So
it's
there's
not
a lot of,
hours and hours. It's like a
no, it's not
like a
like,
session.
yeah, it's not like going to have a psilocybin journey where, you're in it for 4 to 6 hours, maybe 8, right? No. After an hour and a half, you're landing, you're coming back for sure.
Will feel like afterwards.
Yeah, great question. So, um, you kind of know when the journey's pretty much over. You feel yourself coming back in your body. There's less kind of a visual thing happening. Um, you lift up your eyes shades. Some people are ready, sometimes they're not, and they go back in for another 5, 10 minutes. But once people are ready, they lift up their eye shades, and you're still in the medicine space, but you're back. And sometimes people are quiet, kind of processing, but most of the time people are ready to start that integration and start making meaning, you know, uh, and they may be talking through their session or they may not. And if they're talking or they say anything and they're not necessarily talking to me, I'm jotting down notes. Especially if it seems like it's a kind of one of those golden moments, that they've said
Okay.
something that we're going to want to loop back to. Um, but a lot of times people are just starting to talk about what they experienced. And so it's an opportunity to start gently making meaning. I'll talk about, I'm going to just share this one experience with you.
Sure.
Please.
So this gentleman spent, it was about 45 minutes giggling the whole time. And about halfway, and he asked me questions. He's like, there's a door. And I'm like, go through it. Just go through it. I'm here. You're safe. Go through it. But he just kept on laughing and laughing. And I'm like laughing because it's contagious, right? And about halfway through, he got really serious and he's like, I'm not doing the work. I'm not doing the work. I should be doing the work that I came here for. And I'm like, this is the exact work, you need to do. And when he came out and, he was so lighthearted and just really like this lighter mood. And he's like, God, I didn't even do any of this work that I came in with the intention of doing. And I just asked him, I'm like, when's the last time you were silly and just laughed? He's like, he couldn't remember. I'm like, this is what you needed then.
Wow.
You know, I
Yeah.
and so he left with a lighter heart that helped him to then start to unpack, right?
Sure. So it was like a
I
step.
mean,
It wasn't the whole journey for him. It had to be a step, but it was an important step, sounds like.
yeah, yeah, yeah. So I mean, everybody's different, and again, every the same person will react differently in their next journey, and so that's pretty much the session, and so the session 2.5 hours, sometimes 3 if people are deep in the medicine. And, if I'm in somebody's home, I'm not leaving until I see somebody get up and go to the bathroom and eat, eat just a little bite of something and drink, right? Um, in my office, I'll escort people to in their home too. Again, they have to drink a little something and go to the bathroom. People aren't driving themselves home.
I was
They,
gonna
they
say no driving afterwards, I
no, no
assume.
Yeah.
driving, no
Okay.
driving. And then typically, want to make sure I'm handing them off to somebody, that they're not just by themselves. I don't want, and there's a whole list. I have a big instruction of pre and post journey instructions, but I don't want people going out that night. I don't want people having a lot of people over, maybe one person present. Don't go back onto social media. Don't watch, if you're watching TV, at the most a comedy show or a nice, soothing David Attenborough nature show.
Right.
Okay.
Don't watch The Boys. You know
So
what
you're
I'm saying?
resting. You're resting the rest of the
Yeah.
You
day.
just
And the
you
next
want to
day,
play. We just messed with your brain. Everything's open.
Everything's
What do
open.
you
Yeah.
want coming in?
Right. Right.
No news for sure. You
right.
know,
So the next
yeah.
day, they feel like themselves again. They're kind of back to normal.
Well, I hope not. I
So the
mean,
next day, their body feels
yeah,
back,
I
but
mean, the
they are
next day,
enlightened.
right. So the next day, can you drive? Absolutely. Could you go to work? Sure, but should you? Probably not. Give yourself another day to just
So try to get a Friday
stay.
appointment.
Friday appointment is good,
Yeah.
yeah, or a
Okay.
Thursday, yeah,
Yeah.
depending on your
So it's in your
schedule.
body for a while and you're trying to process what you've experienced and you're
Well,
supposed to
it's
take it
not that the
easy.
medicine leaves your body pretty quickly, but you've just had an experience. And so, do you want to be thrown back into the lion's den,
Right.
or do you want to marinate in that experience, start making meaning, and really start that integration? Hard to start the integration if you're going back into a pretty high pressure job situation, right?
Makes sense.
So, yeah, so and people need to do what they need to do, but um, you know, we're trying to, it's not what I'm trying to get at, it's not just the medicine experience. The medicine experience opens a door, opens a window, helps you kind of glimpse, right, into a new narrative, what's possible, but it's the integration that's going to help it stay. So
Mm.
you need some time and to integrate. You want to give yourself some space. Create your own retreat at home. So if you had 5 things that you had to go do, maybe only do 2. That's what I'm saying, right? And
Right.
instead of those other 3 things, let's start talking about integration and meaning making. And then how do you weave this experience into a more cellular, like permanent thing? And so what is integration? So not only are you trying to make meaning of the experience, but what tools from that experience can you bring into your daily life?
So is the integration is that a separate session
Oh
from
yeah,
the
yeah, oh yeah,
journey?
yeah.
Yeah.
So
Okay.
the integration can start sometimes as people are landing. Medicine's still on board, so they're still a little loose, might feel more apt to talk about stuff. So we might start it there, but the integration sessions, yeah, they happen after. So I
Neat.
try to get people in within 3 to 5 days and then a couple of sessions thereafter. Yeah. Yeah.
I do want to bring up because when I first met you and Catherine, you were speaking together. We had Catherine on a few weeks ago, our death doula. She was fabulous. You were talking about people that had life-limiting illnesses and are scared of dying, and how ketamine can help them almost like practice their death to understand there's nothing scary. I want you to talk about that because I found that to be fascinating.
Sure. That's where now we're really getting juicy, right?
Yes.
So,
Yeah.
yeah, hopefully we only die once. I mean, unfortunately in the hospital, sometimes people do it multiple times, right? Um, but most of us will only do it once. And who knows what it's like? I don't know. I mean, I've been doing the work for 30 years. I could tell you what it's like for the thousands of patients that I've done it with. I have no idea what it's going to be for me, right? And so it can be scary. And if you haven't had sort of this non-ordinary state of consciousness, of really being in another space. And again, whether it's with ecstatic dancing or meditation or intense prayer, I'm not saying it always has to be with a psychedelic, but if you haven't had that experience, how do you even know what's on the other side? How do you know if you can do it? Right? And so, again, what the ketamine does, because again, it's dissociative, you are out of your body, and it, because of that out of body piece of this particular medicine, um, it is most akin to a near death experience, because you are entering a non-ordinary state of consciousness, with which death is, which the dying process is. When folks die, and I don't know if you've personally had experience being in the room, but sometimes people might hallucinate. They may see other people in the room. They may be grabbing or something, bringing it close to them. You know, we start going in that liminal transitional space, right? And it might be terrifying if you're all of a sudden seeing things that aren't there. Sometimes people find it comforting because maybe they've seen their lost beloved that they haven't seen for decades. Um, or it might be scary. So this is, can be almost like a practice. So that's when we talk about death anxiety, right? That's what people are anxious about. What's on the other side? What's going to meet me? Is it going to be scary? Is it a demon? Is it God? Is it
And are these sessions
nothing?
really effective for people who have that fear?
They can be, yeah. In those cases, it's a lot about the prep work, because you really need people to sort of let go of that, their narrative that they've created. But most of the time, the ketamine breaks through that anyway. So,
That sounds
yeah,
really interesting and really
yeah,
cool,
yeah.
and nice to have some of those options. Um, I feel like we should bring up, like, let's talk about um, maybe some of the negative press that ketamine gets,
Oh,
um,
Well, and it didn't
and
help. I
how,
think Matthew Perry
yeah,
died
that
on
was, I think,
ketamine. Yeah, good point,
well, we can
Stacey.
talk. I mean, the two really are Matthew Perry and Elon Musk. So, I'll and I don't really have much to say about Elon Musk, honestly, but I think, you know, what came out when he was carrying around his chainsaw and affecting so many people's lives, right, was that he's used a lot of ketamine, and is this the person you want as the poster child, who's um, pretty egomaniacal and does not take anybody else's well-being into regard? No. Is the ketamine because of that? I mean, I don't think he's like that because of the ketamine. Um,
Right.
I would have hoped that the ketamine would help soften some of that, right? Make him a little bit more emotional, intelligent. But how's he taking the ketamine? We haven't talked about that. Is he just using it on his own, and or going and just getting hooked up to an IV and not having any of the prep sessions, not having any of the therapeutic encounters? Because that's how a lot of people receive their ketamine. They just go to a ketamine clinic, they get the infusion, and then that's it.
so nothing else happens in those. They're just hooked up and
Sometimes nothing else
okay,
happens.
Yikes.
And
okay.
again, for some folks that are acutely suicidal or really treatment resistant to depression, that might be what they need. I don't want to poo-poo, I don't want to come off saying there's no use for that at all. But I think if folks are really looking, I mean, that's a way to break through some really um, heavy symptoms. But then you need to use it in tandem in a therapeutic alliance. Do you see what I'm saying? So I
Yeah.
don't know how he uses it. I mean, does he just have a pile and he snorts? I don't know. I can't even speak to it, right? I'm
Is
not.
that
Right.
an option? You can snort it?
Mhm.
Okay.
We don't recommend
No one's
it. Don't do
recommending it.
that. Just want to make sure we get that on the record.
Well, I mean, that's what bravado is, right? That's what so we haven't even talked about what different um, applications of ketamine. I mean, we're talking about applications, but different routes. So I could talk about that now, or I could talk about Matthew Perry. Um, but IV ketamine, certainly in anesthesia, you would have IV ketamine. In end of life, when people were having a lot of complicated pain presentation, we used either subcutaneous or IV ketamine. And I'm just going to stop myself here and just say there's more to pain than just physical pain, right? And so one of the tenets of hospice and palliative medicine, and I'd be remiss if I didn't say this on the podcast, is that the concept
Sure.
is that there's total pain, right? And so total pain is physical, right? It's emotional, it's psychological, and it's spiritual, right? Spiritual, existential.
Total pain.
And really, it's a total pain concept. And when you're talking about end of life, right? So end of life, whether it's 2 years and you're early in your cancer treatment, but really don't have, it's a life-limiting illness. It's total pain that we're treating, right? And so to treat total pain with just here's the IV and not going, I mean, that's a concept developed by Dame Cicely Saunders, and it's the whole basis of hospice and why it's a multidisciplinary team, right? Well, why there's chaplains and social workers and whatnot. And so, and that's what makes ketamine such a great medicine in hospice and palliative medicine. You can use it for pain, all kinds of pain, right? So routes of getting means of getting ketamine when we're talking about mental health. So there are ketamine clinics where a lot of times people are getting a protocol of, what's it, 2 sessions a week for 6 weeks or whatever their protocols are of IV ketamine administration. They'll have a medical clearance. They may or may not have PrEP. They may or may not have integration. You can give the medicine intramuscularly, which is what I do. You can give it subcutaneously, which is an injection, like an insulin injection. Okay. You can give it orally, whether it's a liquid or in what we call lozenges or troches. And that's a lot of times what the therapists use are the lozenges. So their clients get a lozenge prescription from a medical provider. They bring it to their session with their therapist, and they're having their therapy with the ketamine with their therapist. Okay. And there is nasal. So on the streets, it's a powder and you're snorting it like cocaine, but there's intranasal ketamine.
Okay.
Spray. You can get it compounded. And again, a lot of therapists use that with their patients. And then the pharmaceutical of that is called Spravato, which has been the pharmaceutical version of ketamine. It's been available for several years now. A lot of different hoops you got to jump through to get this Spravato through your insurance. Treatment-resistant depression, you've been on X amount of medicines for this long of time, didn't help, on and on. So those are the different routes. So again, going back to Elon, I don't know what he's doing and how he's doing it and for how long and what support he has.
Right. And with was Matthew Perry using it to help with his addictions?
Matthew Perry, I don't know the details. I know when he did his book tour talking about his addiction a few years ago now, right? He was really upfront that the ketamine helped, and it can be used to help people with substance use disorder. Under the right supervision and the right therapeutic alliance. somewhere along the way, that became his substance that he misused, right?
Right.
And it's actually quite sad, and
It is. It's very
yeah,
sad.
it's tragic.
Well, I mean, almost
And he
anything
was,
can be abused, right? I mean, anything that a lot of things can be abused. So
I don't know, I'm
unfortunately,
sitting here drinking coffee, so, we
oh
could talk
yeah.
about
Oh
coffee.
my God.
Happened with Matthew Perry is that he had access
hmm
and he was using doses that were at anesthetic doses.
Right. And by himself and in a body of water, you know?
Right.
None
So
of it makes sense.
that's
Yeah.
not
So,
that's a recipe
so
for
sad.
poor outcome, and it is sad. Um, so yeah, I don't know if that answered your question, Stacy, about those.
It,
I don't think there's anything else in mainstream.
I know I haven't heard. I just always think of Matthew Perry.
We have a few questions left on our list, but we're running out of time. So, Stacy, is there a question you want to make sure we ask Gayle before we let her go today?
I kind of like the one either with like what is the one message you wish everyone understood about the end of life experience? Because you've been around so many people at this phase of life, being in hospice and palliative, like, and everyone is scared of dying. Like, what you must have so much knowledge about the process. Like, what can you share with us and our listeners about the end of life experience?
I think the thing that I would really want to share is it is never too early to have conversations with the people in your life about this, because the people in your life who are going to be supporting you are the ones that are going to make or break it, right? So if you have the conversation and you could say, "Hey, I'm scared," and then that person knows you're scared, and then then you start together looking at how can I be less scared, right? And what can I do to unpack it? And to listen, we're all going to die. We know that, right? Death and taxes. We just paid our taxes, and hopefully death is decades away for all of us, but it's going to happen. And so, how do we prepare ourselves? And that's like starting now, right? What do I need to reconcile now? What regrets? What have I done that I absolutely haven't gotten done, but I know I absolutely need to? It's like those deathbed regrets, right? And I think if we start having the conversations with the people we love and that love us now, and not wait, right? And to dismiss it, I think what happens when people get that diagnosis, whatever it is, end stage heart failure, end stage COPD, a cancer diagnosis, a Parkinson's diagnosis, they don't want to talk about death as if they're going to bring it on sooner. We're not that powerful. If you talk about it as soon as you get the diagnosis, again, you're so much more empowered to face it when it comes. So I think having honest, hard, right? They're hard conversations. They're heart-wrenching. But if you have them early, it will help. That I can almost guarantee.
That's good advice.
Thank you. Gayle, we like to ask all our guests the same last two questions. The first one is, if you could give our listeners one to do, like a takeaway from today's conversation, what would it be?
To do. Be curious.
That's great.
I like
Be
it.
curious.
Yeah.
Thank you.
All right. And then the last question we like to ask is here at the podcast, we like to say, don't panic, just pivot. Is there a recent small change or pivot you've made in your life that you're proud of that you're willing to share?
Oh, yeah. Oh, I like that. Just pivot. I think it's just the constant lesson. I really don't have control over anything. It's all about how do we react. And I just need to keep um, honing the grace in how I react.
React with grace. Great. Well, thanks for your time today. This was really enlightening and eye-opening and very interesting.
Well,
Yeah,
thank you guys
absolutely.
so much. I appreciate great questions and I appreciate the time. And yeah, thank you so much.
Thank you for listening to the Digestible Podcast with today's guest, Dr. Gayle Bereskin. You can learn more about Dr. Bereskin and her services at her website at revolutionary-care.com. If you enjoyed today's episode, please share us with others. It's the best compliment you can give us. If you have questions or comments, you can email us at info@digestiblestrategies.com. We look forward to hearing from you, and remember, don't panic. Just pivot. The content shared on this podcast is for informational and entertainment purposes only. We are not medical professionals, and the views expressed here are not intended to diagnose, treat, or cure any health conditions. Always consult with a qualified healthcare provider before making any health-related decisions.